We are in Studio 61 here trying to shine a light on men's health because men's health is community health.
That's right.
This weekend, Trinity Health of New England, My People Clinical Services, and a lot of organizations are all coming together to prove just that. It's happening Saturday at the Connecticut Institute for Primary Health Innovation, which is right on the St. Francis Hospital campus in Hartford. So happy to be joined by Carolyn Alessi and Abdul Mohammed, who are helping, just two people really helping to put on this great event that's involving a lot of people and a lot of community partners. Thank you both for being here today. This is something we cannot talk about enough. Carolyn, I'll just get to you in a second, but Abdul, I just wanted to start from your part about sort of the origins of this, why you felt like your groups and why this is so important in the first place.
Well, you know, many of the issues that men are having are preventable. And so we want to make sure we get the word out on prostate tests, colorectal tests, different tests that men can get done to keep them from basically having any issues or problems that could cause them to die.
Yeah.
You know, so we really just want to be able to do this event so that we can be in the forefront of making sure that people can prevent anything that's going to happen to them in the future.
Prevent is the key word. I hate to overgeneralize, there's just something about guys, we don't love the doctor.
That's
and
right.
we will go for treatment when we know there's a problem. That's not the cost-effective way to do it. You got to prevent it, and that winds up being a lot better for you and a lot better for healthcare providers. And I'm glad that's what a lot of this is focused around, not just the tests, Carolyn, but you were telling me before, education as well.
Absolutely. It's so important for people to understand just what they need to do in order to take care of themselves, you know. And so on the day of the event, we'll have a lot of our primary care doctors, specialists doing screenings, but also providing education around men's health. I know when Abdul and I were planning this event together, we came up with the tagline, men's health is community health, and that resonated with me in a big way. From a personal perspective, I lost my husband 10 years ago to coronary artery disease. And what I did not know is that in his early 40s, he was given erectile dysfunction medication, which is unusual for a young man to be given that. But it was a warning sign towards heart disease. And if his primary care had made that connection, then he would have been screened and we wouldn't be here today. So I think that's really important to really understand. And there are specialists within the Trinity Health of New England Men's Health Institute that can really connect those dots for men.
Absolutely. So a lot of people out there, if you're thinking about going, what do people need to know if they want to attend? Is there anything they need to do beforehand?
No, nothing. They absolutely, we remove all barriers for them. So we have free testing available. We are providing lunch, so they are able to enjoy a meal, a healthy meal, also having education with health seminar series with some of our specialists. So all we need for them to do is walk through our doors.
That is wonderful. And Abdul, we mentioned before, this to a large degree is something that is a problem with men, but especially men in underserved communities. Why don't you talk about the extra importance of that?
Well, I think that's a great point that you made. I mean, a lot of times men in underserved communities are not even thinking about go to the doctor, and so they don't even have a relationship with their doctor. So therefore, they by the time they go to the doctor, it's already too late. And so we want to just basically prevent them, get them to these events, and make sure that they are ahead of any problems that may occur.
Yeah, and well, I'm not saying all of these are happening at the event, but you just need to understand how many good preventive tests are out there, pretty much no matter what you have. Prostate cancer, there's PSA testing. Colorectal cancer, there's Cologuard. You even mentioned coronary artery disease. There are coronary calcium tests you can do that will give you about a 10-year advance head start on whether or not you might have coronary artery disease developing. So prevention is the key. That's what this is about. One last thing, where is it happening one more time, and the hours that people can go there?
It's happening, Abdul can give a little more information
260
on that.
Ashley Street. We'll right on St. Francis campus.
The campus,
And just come on down. You'll see a balloon arc. You know, you can park over at the Urban League, and you can come right around the corner and join us.
It's on the corner of Woodland and Ashley, and it's from 1:30 to 4:30 p.m.
1:30 to 4:30. There you go. As many people as they can help, they will help. And thank you so much for joining us to get the word out.
Thank you
so
Tim.
much.
Pleasure.
Thank you very much.
Thank you.
Yes, we certainly do appreciate it.